Hello, my name is Ayami Bamakole, and I'm here to teach you or show you range of motions for the wrist. So first of all, before we do that, we're gonna, of course, knock on the door of the patient's room, come in, practice hand hygiene by washing our hands, um, make sure make sure you introduce yourself to the patient, and they're close curtains or close the door, which giving him or her, the patient, um, privacy. So before we do that, now we're not working with the hospital bed, but we have a normal bed. So we're gonna assume that this is a hospital bed. So with the hospital bed, we have the rails between on the sides of the bed, and we have a remote control. So it depends on where you're starting first. Either you start, for right now we're starting with the left hand side. So we're gonna lower the rails of the bed, and of course before we do that, we're gonna either reduce or increase the length of the bed according to our level, because we don't want to be slouching or bending down to treat the patient. We need to make sure the patient is at the same level of us, of the nurse. So we're gonna, after raising the bed, we're gonna pull down the rails of the bed. So we're gonna assume that we're pulling down the rails of the bed on the left side. So once that is done, either you tell the patient what you're gonna do, or you're gonna tell the patient as you're doing it. So first we're gonna open one arm of the patient, and we make sure their wrist is resting on our palms, and their hands also are resting on our palms, like this. So we're gonna do some range of motions. So it's gonna be flexion, extension, hyper extension, radial, ulnar. Now it's gonna be flexion, extension, hyper extension, radial, inwards, and ulnar towards the pinky. We're gonna go 5 to 6 times. Flexion, extension, expert extension, radial, ulnar. Flexion, extension, hyper 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 extension, radial, ulnar. And once you're done with that, we're gonna put your arms back into the blanket. And once we're done with the left hand side, we're gonna raise the rails of the bed of the left hand side and go to the other side and do the same thing. And you make sure you tell the patient, inform the patient they're gonna do the same thing with the last arm to the second arm. So once you're done with that, you will lower the bed. You raise the rails up first and lower the bed with the remote. And when you're done, you give the patient the call button, and make sure you record and report the information. And I hope you liked the video, and I'll see you next time. Bye.